ഡോക്ടറുടെ സേവനം ഇനി വിരൽത്തുമ്പിൽ. ക്വിക്ക് ഡോക്ടർ ആപ്പ് ഡൗൺലോഡ് ചെയ്യൂ. വീട്ടിലിരുന്ന് ഈസിയായി കൺസൾട്ട് ചെയ്യൂ.
Hi, I'm Dr. Maria Grace, speech language pathologist at Astakine, Astamed City, Cochin. I'm here to talk to you about autism. When I say the word autism, what comes into your mind? Is it something which is positive or negative? So, autism is not a disease, it's a condition, it's a way of life, it's a different way of thinking, wherein the brain of the autistic person is wired in a different way. So, they appear physically normal and they think in different way, they learn in a different style unlike the others, and they find it hard to socialize unlike the others. So usually when we say autism, people think it is weird or they are clumsy, they are hyperactive, or children are really hard to manage, they do not understand. These are all the negative things which come into the mind of parents. And usually the mothers or the parents they are blamed to be born with a child with autism. It is considered as a disgrace or shame. But of late, there is increasing awareness about autism, and I was super excited when I met with parents who came for a consultation just 2 days back. They were so positive about their child with autism. There was nothing negative they had to say. They're saying they're proud to be parents of this child, and they were saying all the positive things, like the child is very focused in what he does, and there's nothing that can stop him from trying out new things. Like whatever skills he learns, he puts in all his effort. He's not distracted, or he doesn't accept failures. He attempts again to achieve the goal. And if they go for shopping, he doesn't go and grab everything unlike other children. He has a clear thing in his mind, and he just goes and picks up only that particular thing, which is a good thing, and he's very adjusting. So they're great people, inspiring people who have had autism and contributed a lot to the society. For instance, Albert Einstein, Isaac Newton are some of them who really contributed a lot to the society. So we need to identify the strength of these children and not judge them based on their external behaviors. For instance, in early ages, they may have a lot of sensory issues, a lot of hyperactivity, so they are easily misunderstood. And many of them are kept within the house, or they are not told that they have parents fear how the society would react. So the problem is not with autism actually, but it's the way the society creates that stigma. The problem is society's rejection of this diversity, and the parents have the fear of being misunderstood if they say. But it's all in the thinking. If we change the thinking of the people around us, if we change the thinking of how parents view autism, I think we can have a bright future for these children with autism. They'll be more comfortable to live in this world with dignity. Currently, many children are struggling because people do not understand them and their abilities. Like they hear like any other normal children. They understand. It's not that they do not have empathy. They do have empathy, but they do not know how to express empathy. They have emotions, but they do not know how to express the emotions. So they are easily misunderstood. And some children are super intelligent. They have exceptional talents in various domains like academics or skating or reading skills or any such skills. So we need to explore that and work on that and train them with love and care. We need to provide them an environment of kindness. So first step is identifying autism. at an early age so that the brain is able to learn and acquire new skills more easily. So we would suggest as early as possible. So parents, of late many parents are coming at an early age, and we would do a detailed assessment, and after the assessment we would advise the parents to go in for speech language intervention, occupational therapy, and behavioral therapy, along with intensive home training and play school. Of course, in this pandemic situation we do not have that opportunity, but once things get back to normal, we would definitely advise the parents to send the child to play school so that we would encourage social skills development. So once a detailed assessment is done, we start working on the children. We encourage the parents to learn the methods of teaching, methods of providing intensive language stimulation back at home, and how to work with the child back at home, which includes a predictable routine in the daily life. For instance, they would plan like 1 hour of play, 1 hour of sitting and performing tabletop activities, 1 hour of physical exercises or OT, occupational therapy related exercises back at home, and then say 1 hour of interaction or group games, family games. And it could be other activities also could be included, like watering the plants or swimming, or depending on the child's age and level. So and one thing we should understand that this takes time. Like parents usually they are sunk in depression and they go in search of cure, doctor shopping. They want immediate changes. So we need to understand that autism, it's not a disease, it's a condition, it's a style of living. So we should view it as part of the normal human culture. For instance, in the book Neurotypes by Steve Silverman, so he beautifully says that it should not be seen as something abnormal. Autism should be viewed as part of a normally developing, typical neurotypical people, one extreme or the other extreme, all, whether it's autism or Down syndrome, any disability for that matter, should not be viewed as a separate thing. It should not be viewed as a defect. It should be viewed as part of the natural human spectrum. So that would make these individuals more comfortable and contribute better to the society. So if we have a good training with good care and acceptance, so we will be able to help the children to realize what their strengths are and then help them to contribute to the society for with whatever talents they are blessed with. So we need to understand that they communicate differently. Some children have behavioral disturbances, some children are verbal, some are non-verbal, some children have severe difficulties, and they may be trained to do basic things like cooking, self-care by themselves. Some progress to school and they learn basic skills of reading, writing, arithmetics, and some are extra intelligent, like they are super intelligent, they do excel in academics or any particular skill. So depending on the type of child and their skills, we need to support them. So usually what happens is, when a child receives a diagnosis of autism, parents go and look into the internet, they search, and they get really very anxious when they see various kinds of videos on autism, on severe behavioral disturbances, etc. But we need to remember that each child is unique, each child is different. So there is a child with very subtle symptoms, for instance, very good language and reading and writing skills, but and the child may have difficulty in interacting socially. So that is the other end of, we call it as social communication disorder. On the other hand, a child can be non-verbal. Child may communicate using an alternative and augmentative communication system such as Avas. So it's a device, they take the help of a device to communicate their needs or express their opinions. So in speech language intervention and related occupational therapy and all, we have various approaches. So worldwide used approaches are applied behavior analysis or the verbal behavior approach, which came up later. And then we have picture exchange communication system, we have relationship development intervention, floor time, then prompt for children who have apraxia of speech along with autism. So in apraxia of speech, it's a condition where child has difficulty in imitating speech sounds or words, so which creates a barrier in acquisition of language. So they struggle to imitate. So in such conditions we use prompt. So in children who have a lot of behavioral disturbances, like they are very hyperactive, or they are not listening to instructions, or they throw tantrums. So we try to find out what is the reason behind such behaviors. So how do we find out the reason? It is through a ABC analysis. ABC analysis is antecedent, behavior and consequence. So over a period of 1 week or 2 weeks, a behavioral therapist would be able to help you out too. You need to analyze what precedes the behavior, which is antecedent, what follows the behavior, which is the consequence, and based on the pattern of the behavior, we find out what could be the reason of that particular behavior. You can remember it as C teams. C is for communication difficulty. If the child is frustrated that he is unable to communicate something, he may show tantrum. Or it could be T for tangible, to get something, he may show tantrum. Or it could be escape. For instance, the child cries, especially when he is made to do a tabletop activity. So he wants to escape from the activity. So that is another reason. A is for attention seeking. For instance, if the parent is talking on the phone, so that's when the child starts screaming or throwing the things. Then it could be medical reasons, which the child is not able to express verbally. So child screams or cries. Or it could be sensory reasons. It may be hypersensitivity or hyposensitivity. For those kind of issues, an occupational therapist help would be of great benefit, or a sensory integration therapy would be helpful. Coming to ABA, applied behavior analysis, previously it was a discrete trial training which was followed. That is, we select specific goal and we give a specific instruction and elicit response by giving different prompts, and then we provide a reinforcer, which may be a praise or anything. The stimulus could be an instruction. So that behavior would increase if we give the right reinforcer with the child likes. So that behavior would increase, that response would increase. So this approach is used to teach different language concepts. And there is verbal behavior approach, which came up later. So in that approach we have MANS, which is requesting, TACT is labeling, intraverbal is like filling in utterances or rhymes. Okay, MANS, TACTs, intraverbals, and we have echoic. Echoic is imitating sounds. So we work on each of these domains, helping the child to express his needs. Like we have some children who label, say, 100 words or 100 pictures in a book, or child can say numbers, colors, shapes, but child has difficulty in expressing needs or requesting for his needs. So in such cases we do work on manding. Okay, And based on these principles only, PECS is also developed, which is picture exchange communication system, wherein the child is encouraged to initiate communication by exchanging pictures. So, and there are 6 phases in that, wherein we move from single word to sentences and then commenting. So there is also an approach called as structured teaching. So in this particular approach, we modify the environment in such a way that there is structure, or the environment conveys to the child what is expected of him. We also use visual schedules, wherein the entire routine is displayed pictographically, because many of these children are good at visually. If you say the same thing only in a auditory mode, that is, only you say it but you are not showing any images, so learning will be harder. Whereas if you use photos or images, it will be easy for the child to learn. And when there is a structure in the routine, there is predictability. So if you inform them in advance, like these are the things expected of you, or these are the things which we are going to do today, or within activity, these are the steps of doing the activity, so we can expect better performance by the child. And child could be made to do things more independently with the help of visual schedules. For some children, object schedules will be helpful for younger kids. So then we have floor time and relationship development intervention. So floor time is spending more time playing with the child, letting the child to lead you. In relationship development intervention by Steve Gutson, it helps to develop co-regulation, helping the child to socialize and connect with people more often, more easily. So we also have many other social interaction based approaches. And there are approaches like Hannon's, it takes 2 to talk, and more than words, which help and guide parents to teach them how to provide a good language stimulation. So even in RDI or in Hannon's approach and all, they encourage use of declarative language, wherein parents are taught to, we teach them to talk in neutral sentences. There is no commands or instructions. Okay, it's more of comments. For instance, I'm so happy. Oh, that's fallen down. So these are the things a mother could speak, or we could use parallel talk, like just keep describing what the child does, or say what you do as a mother or a parent. So these are some of the approaches, and we use a combination of these approaches according to the needs of a child. And when to start intervention? As early as possible. And you would need definitely the guidance of a professional to understand what goals to work on first and how to progress to the next level, because language development per se will take time. For instance, a typical child would learn to talk like an adult only by the age of say 4 to 5 years. So it takes 4 long years to learn or acquire language. So you should not hurry. You should not be in a hurry to teach your child, or stop. You should not stop working with your child just because he's learned to say few words. We need to continue and expand his utterances, expand the length of utterances, then teach narratives. We have to teach conversational skills, social skills, and then ultimately help him to lead an independent life and social life. So these are all done as a team. A team effort would definitely bring in a lot of changes, and the primary role is played by a parent under the guidance of a professional, along with the help of the society. So I would request the societies or whomever is listening to this talk to change your attitude towards what autism is. Realize that these children are just like you and me, and we need to accept them as the way they are, encourage them and make them feel comfortable instead of sympathizing with them. They don't need our sympathy actually. We need to recognize they're blessed with intelligence, just like you and me. And maybe say after 20 years or 30 years, there would be many more autistic individuals living in this world. And we should learn to be more tolerant, more patient, and accept them. As each of us are differently created, they're also differently created with a definite purpose. So this kind of attitude would definitely help the family to lead a life of peace and happiness. So we should recognize them as humans too, and do our best to help out everyone, and realize that it is amazing to see how these children flourish and contribute to the society. Thank you very much.